when we started working, like, it really does feel like home.
Two Central Illinois NICU nurses are treating families in a place familiar to them. It's the same place where these twin sisters' lives began more than 2 decades ago. They both knew they wanted to go into the medical field, but it wasn't until going through nursing school together that they felt the NICU was the place they wanted to be. WCI3's Theodore Coulivares has their story.
No need to adjust your screen. You're not seeing double. But people do tend to mix up Justine and Zoey Obert's names when they see the twin sisters.
I wear a headband, and Justine wears the different glasses. And there's one day we both wore headbands, and they're like, no, you can't do that.
Justine and Zoey are both nurses in the NICU at St. John's Children's Hospital in Springfield, the same place they were born in 2002. When their mom was pregnant with the twins, she had preeclampsia. Doctors were concerned about her health.
By the time they had assessed my mom and said, we need to get you into surgery, you're not going to make it if we don't get you in now.
So the twins were born at 31 weeks, 9 weeks before their due date. They have matching tattoos with the exact time they were each born. Justine spent 21 days in the hospital before she was able to go home. Zoey stayed a few days more.
I'm taking care of babies that are 25, 26 weeks, and it's crazy to see how I would have looked if I was that young.
As they grew up, both twins knew they wanted to be in the medical field. After high school, they both went to the same community college. Then, Justine and Zoey went to St. John's College of Nursing. And after going through their clinicals, they both wanted to work in the same place where their lives began.
We both said neither one of us would work in the same spot for our sakes, but as well as our the staff, our coworkers, and patients, just not to confuse people.
They only had one position available, but they got some good news.
She tells us, you guys made it. They created a position for both of you. You are now NICU nurses. And we were like, oh my gosh, so we're screaming, we're jumping around, we're like going crazy.
The two have been working in the NICU since January, helping babies and families that were in their same position 22 years ago.
I know how my parents felt when we were up there, so it just makes me feel even better that I'm able to give that respect back.
Giving those families hope that, like, I'm a success story. Like, I was early, and look at me now.
Reporting in Springfield, I'm Theodore Coulivares.